What is up, internet? My name is Thomas. Today we're going to be talking about inflammation, what it is, why it's good, why it's bad, and how cryotherapy affects it. So jumping right into it, what is inflammation? Inflammation is your body's reaction to what it basically thinks is like damage or infection. Basically what happens is that your veins will open up to allow more blood flow in vasodilation. We talk about vasoconstriction a lot, so vasodilation. Basically allowing more chemicals to get in there. More white blood cells are produced and sent to the area as well, and the white blood cells themselves release several chemicals. One to basically cause pain, to keep you from using that area wherever it might be. The other ones are going to be like bleach and hydrogen peroxide, basically to start killing off invaders. Behind that comes pus, and behind that comes the actual healing process. Interesting thing, a lot of different cells are moving to the area. Like there's an insane amount of stuff actually going on in inflammation. Like we don't even actually fully understand inflammation at this point, like what really causes it, why it happens. I mean, like we have so many chronic diseases and whatnot like that follow behind it, with like heart disease and stomach problems, rheumatoid arthritis, cancer, skin, like etc., stress, headaches, fevers, etc., can all be potentially caused by inflammation, which is why this is a really important thing to talk about today. With the excess swelling as well, another really quick interesting thing is that some cells, their whole purpose is actually to open up more the area so that other things like white blood cells, which are larger, can get in. White blood cells actually sometimes have to fold themselves over literally so they can fit in. So you can kind of get an idea of the inflammation that's actually really happening, is that things are really condensed in there in some cases. This can be bad, we're getting into the good. Let's stay on track. Let's get into the good. So this is good in a lot of cases. As long as it's not like a chronic or long-standing issue, it's a good thing. If you get stung by a bee, it's gonna swell up really bad because basically there's a bunch of inflammation there that's trying to kill that venom off so it doesn't do any kind of damage. If you are working out, inflammation naturally happens because it needs to go to the area to make sure first off that there's nothing, no infection or anything like that that's going to happen, and then follow it up by like repairing and so forth, right? So there's some quick examples. When it's bad is when it's chronic. It's when it's long standing, and it's bad for a couple reasons. Basically, it's swelling a bunch, and excess swelling can actually cause like veins and stuff to burst and then make it take even longer to repair. But in addition to that, and probably more important, is the fact that you just have something that's attacking your body in some cases without rhyme or reason. Like I said, it releases a form of bleach. So like a lot of things, like I just mentioned, like heart disease and rheumatoid arthritis are caused by this reaction, this chronic reaction. Basically, like in arteries, in the heart, like excess, fats and stuff like that, or just like how it gets clogged, like it'll attack that stuff. In your stomach, you know how they say that foods that you eat can actually cause inflammation? Yes, it's true. I don't know the exact specifics of it, but you guys probably know there's an insane amount of bacteria that lives in your stomach, like a huge portion of it, like so much stuff, like we can't even identify everything in the stomach. It's just a weird situation. So it'll actually start just attacking stuff in the stomach that it doesn't need to. So it'll hurt you in that area as well. So how does cryotherapy actually help it? And actually, real quick, I want to dial back. I want to say one quick thing. With working out, since some inflammation is a good thing, you should wait at least an hour before doing cryotherapy when working out, because you want some inflammation to take its actual normal course so that it can do its job. Like I said, really the only time it's really bad is when it's consistent for a long period of time, and the main thing you're worried about is the body attacking and destroying itself. So how does cryotherapy help inflammation? Basically through vasoconstriction, and vasoconstriction alone. Well, not alone, but that's the main thing. We mentioned a moment ago that vasodilation happens when inflammation occurs, which basically is the widening of the veins to allow more blood to go through. Vasoconstriction is what happens while you're in the chamber, which is the opposite. Basically, if you can imagine an eye, how it dilates larger or smaller depending on how much light is in the room and what's being absorbed, it's similar to this. Basically, the veins become really small and pull all the blood from your extremities to your core. So if you have an area that's swollen, like, you know, if it's your hand or something like that, I'm just gonna say in a rheumatoid arthritis patient, the excess inflammation will be pulled from that area along with the chemicals that are attacking the area, then they'll be pulled to your core, basically reducing the pain and reducing the damage that's being done to you in the process. So need I say more? I mean, need I say more? Really, guys, that's pretty much the conclusion right there, actually. That's pretty much like where the punchline is. I hate to just end the video on such a weird note, but if you enjoyed the video, please drop a like. It helps us a ton. And if you have any questions, please drop a comment below. Like I said, inflammation isn't even fully understood by our best guys, so I'm not gonna know everything about it. I'm not a pro on this, but I did think that it was necessary to talk to you guys about it, especially when some of our patients are rheumatoid arthritis patients. So I hope you enjoyed this video. Till next time, guys, take care. Peace.